My name is Sarah Lander, and I'm an orthopedic surgeon, and I specialize in sports medicine. When I grew up, athletics and sports was a way of life for me. When I was in medical school, I kind of knew very early on that I loved surgery. I loved working with my hands in the operating room, and so was kind of drawn to our surgical specialty. And then with my athletic background, really felt that orthopedics was the right choice for me. And so once I decided on sports medicine, I wanted to go, to Duke University, where I really learned cutting-edge sports, techniques, procedures, as well as working, with high-level athletes in a high-level team type situation to get them back as soon as possible and really to their highest level of play. And so working both as, non-operative treatment modalities, but also with, different techniques, surgically, arthroscopy, is just something that is really important to me. So I do have a special interest and a passion for treating pediatric and adolescent patients. I think as an athlete growing up, I find that I have a better understanding of what an injury means and how devastating that can feel for that patient. And then as a parent, I feel like I can understand how an injury to a pediatric patient doesn't just involve that patient, it's the entire family unit. I really specialize in the shoulder as well as the knee. And so a lot of times when we're seeing knee patients with injuries in sports, frequently they're both ACL injuries, meniscal injuries, or even chondral or cartilage injuries. And focusing on the knee, there's a lot of new and kind of, cutting edge things that are coming out all the time in sports medicine. And so I really find it exciting to be able to offer these treatment options to patients. I am a huge component of having a team-based approach, but also a team-based approach for our patients. And I think that we do a really good job there. So not only do you have access to your surgeon, your primary care physician, but also we have a very close connection with our physical therapists, our athletic trainers, and frequently, I'm having patients, if they need be, work with a sports psychologist or nutritionist as well. I think we're always staying on the cutting edge. And so whether that's kind of our facilities or, research, patient care, our outpatient facilities, we're really always striving to be excellent. I think that's something that I really like about University of Rochester is that they're very supportive in, my research mission and agenda to hopefully improve patient care, but also supporting kind of the team-based approach or collaborative care to patients so that patients never have to feel alone. There's always someone there for them in their, in their journey to recovery. I'm incredibly grateful for patients, for having them kind of let me into their lives at a time when they're most vulnerable and having them trust me. It's truly an honor and a privilege to be able to do this. And seeing them be able to get back to the things that they enjoy, whether it's a pain-free life or whether it's back to high-level activities, it's incredibly rewarding and inspiring. So thank you.